demand in general practice across the country has changed a lot. The volume of appointments has gone up compared to, say, how we did 5 years ago and pre-pandemic. The volume has almost doubled in that time, but yet the workforce hasn't necessarily doubled to reflect that, so we've had to find different efficiencies. A lot of those efficiencies have come through digital solutions. Having Surgery Assist, having the X-Flow, you can educate patients while they're waiting, while they're trying to access the service. But you can also do it 24 hours a day, so they're not sort of thinking, all right, what time do I have to call my GP practice? When's the busy time? What time do I have to ring up before so that I can actually get seen? They can do that out of hours. They can get the information they need, or they can get the appropriate healthcare any time of the day. What it allows it to do is that a patient can request to jump into the phone line queue from the chatbot on the website. But while they're doing that, they can also see how long the queue currently is and how many people are waiting. So they can do that. So it's not like sorry, you've reached the end of this chatbot, you now need to call us. It actively does that. You just click it, you put in your telephone number, and they get a call back when they're at the front of the queue. So they're not waiting, which is really useful. And when we realised that 85% of our patients were still contacting us through phones, we needed to do something differently. A lot of the online consultation tools are only available for those that are digitally able, but then that is inequitable access level for those that aren't digitally able. We've had a few people using it that don't have mobile phones, let alone smartphones and email addresses, so we know that there is a small population that are choosing to use it that aren't digitally enabled, but are perfectly accessible during the phone. It gives the patients another option, and it gives them the same then equitable sort of access. They don't have to wait, they can't believe how quick it is, how easy it is to do, how they then get a response sometimes before we've even opened. The voice agent really works.
The patients quite like the AI. Now they've got more used to it and they know that we action it quite quickly. The easier it is that we can just read it, we can put it straight onto triage if that's what's needed. Generally on the whole it picks up 99% of what the patient is saying accurately.
It's like a reassuring safety net for our reception team and our patient services team. They're not missing calls in the queue because there is another option, but you can also deal with the results as they come in, and it is quicker because you can just read the words, work out what they need very quickly, and it's in the patient's own words.
Before using Intellect, the amount of paperwork and risk of maybe not capturing everything that the patients come in to tell you, it can be quite overwhelming. The beauty of the ambient scribe is that I can actually look at the patient because I now know that it's taking down what I need it to take down. It acts as a safety measure. So often we take down valuable information, but it doesn't get saved, and the fact that that's all coded saves a lot of time.
Before the technology came into play, we would overrun in clinic. We'd try and pay attention to the patient instead of worrying about what you're writing down on their notes. Probably saves me half of my clinic times, whereas when I'm facing the computer screen, I miss those social cues. When I'm actually talking to and engaging with them, it's really clear at planning out what we were talking about, the direction we were going in.
The thing that we find really brilliant is it brings in a lot of the contact data into one spot. So we've got a platform for NHS app data, we've got a platform for our text messaging data, we've got a platform, but it's very piecemeal. And actually you want to be able to compare like for like. So you want to know if you've changed a feature in your telephony system, what effect has that had on your OC, what effect has that had on the NHS app? And what it's allowed us to do is we integrated registration of the NHS app into our telephony system in and out of hours. So it's an option as if you're going to talk to somebody on the phone, but it then texts the patient a link of how to do it and an instructional video. And what we've seen since implementing that, and we can see it on Surgery Insights, is that the registrations have continued to go up. It doesn't even feel like a conscious decision to stay or continue using. It feels like a natural evolution.